It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, this is Tammy Patzer, and I'm really excited to introduce today's guest, international best-selling author, Dr. Michael Posner. He is a master chiropractor, complementary wellness professional, health coach, and, like I said, international best-selling author. He helps you naturally restore well-being in your body, mind, and spirit. Dr. Posner draws upon his vast wealth of personal and clinical experience and combines the best of Eastern and Western healing philosophy into a unique system that eases your pain, helps your body work better, improves your quality of life, and helps to empower you to transcend your present state of health, regardless of where you may be on your current path. Dr. Posner offers practical and simple ways to live a healthier, happier, less stressful, and more authentic life. Welcome, Doctor.
Thank you very much, Tammy. It's a pleasure to be here.
I want to know more about your book. It is called Well-Adjusted, A Journey of Transformation for Body, Mind, and Spirit. And it was written by you, Dr. Michael Posner, and Lois Posner, who's a registered nurse and an LMT. So you and your wife put together this book, and this is not a little pamphlet. This is a 361-page Bible almost of a journey for transformation, body, mind, and spirit, well adjusted. I'm really excited to learn more about it. So can you tell me more about why you wrote this book?
Well, yes. When I was a young man, I was very ill, and you name a disease, I had it. I was always sick. I had all kinds of allergies. I had psoriasis. I was always in joint pain, and this was when I was a very young man. When I was about 17 or 18, I was very, very ill, possibly even at death's door, and I decided to rehabilitate myself through karate. So I joined this karate class, and fortunately there was a chiropractor in the class, and I had told him about, all my symptoms, and he said that I should come and see him. He thought that he could help me. So I did just that, and within a few months, all my symptoms were gone. I had no more allergies. He helped me with my nutrition, and he helped me with my neurological symptoms, my joint pain. And just through chiropractic, he taught me that chiropractic isn't just about pain, but it could help with total body health because it creates better communication between the brain, the nervous system, and all the body parts. So everything is affected by the nervous system. And that's what inspired me to want to be a chiropractor, because I felt like if he could transform me that way, I wanted to do that for other people. So that was my main motivation to become a chiropractor. And that was also like my springboard into learning about other holistic health principles, such as acupuncture, massage, and nutrition, and Tai Chi, and Qigong, and yoga. So basically, I started to blend Eastern and Western healing modalities into something I now call my signature holistic chiropractic approach.
That's really interesting, because so many people, you said it, they have joint pain, they have allergies, and they just don't feel well. And you talk about chiropractic, but at the same time, you're talking about holistic medicine. is there a misconception about what a chiropractor is and what a chiropractor does? It sounds to me like you're taking, like you said, you've blended Eastern and Western medicine together. Can you just talk a little bit more about some of the misconceptions people have about what chiropractic is and maybe about what you do?
Absolutely. First, I'd like to address just the fact that a lot of people don't realize that chiropractors are doctors, that we study the same stuff minus surgery and drugs that medical doctor does. So we take exactly the same courses, and some areas we even take more, such as X-ray and diagnosis and pathology. So that is one misconception. Another big misconception is that chiropractors only treat people for pain. Truth be told, our concern is structural balance because of the spine and the nerves exiting from the spine going to all the body systems, organs, glands, even down to the very cell. So chiropractic isn't just for pain, but it's actually a holistic healthcare system to create wellness. Just to give you an example, Tammy, my children are now 32 and 31 years old, and they have never, ever been under medical care in their whole life. And I've seen tremendous transformations in health from infants to 90-plus-year-old people.
So when you say medical care, in other words, because you've taken care of them and you're coming from a health perspective instead of an illness perspective, your 31 and 32-year-olds have been healthy because they've
Correct.
Actually had ongoing health care, not ongoing care for when you get sick. That's really interesting because you yourself, you're 67 years old, and tell me a little bit about how your health is today compared to when you were young.
Well, I truly have had minimal incidents of slight colds over the years, maybe once or twice in the last 30-plus years. I no longer suffer from any of the things that I did when I was a child. My allergies are gone. All the joint pain that I had is gone. And, I maintain my wellness with chiropractic, and I do not get sick anymore. I think that, another misconception that people have is that you could just come in for a pain, and when we get rid of your pain, you're done. Some people would actually go as far as to say chiropractic is addictive and they don't want to get started. And, I point out to people that, hey, do you go to the gym? And they say yes. I say, well, why do you keep going? It must be addictive. I'm being facetious, of course, and I'm trying to show them that any kind of health care needs to be done consistently. You can't just go to the gym once and say, I feel great, and I'm not going back again. You need to continue. And it's the same thing with brushing your teeth. You can't brush your teeth once and think that's good for a lifetime. So all health requires maintenance.
Right. And it is interesting because of how we are in the United States, we always think of health. Again, we are always looking at sick care, not health care. If you were to really diagnose the what these words really mean. I wanted to ask you about mindset and thinking, because one thing I noticed about your book, it's not like a book about health in terms of, oh, you're sick, but you actually are talking about how to do this transformation, body, mind, and spirit. So can you talk to me a little bit about thought and how that really does affect how healthy you are and how healthy you can become?
Yes, I can. Well, first of all, people don't really understand what health is. People think that they're healthy because there's no symptoms present at that moment, and they think they feel well. But, I use an analogy of a dimmer switch with people. I go, in my room, I'll dim the light a little bit, and I'll say, can you see fine? And after a moment or two, they'll go, yeah, because my eyes have adapted. Then I'll make it a little lower, and I'll wait a minute, and I say, how do you see now? And they say, I can still see okay. And I keep doing that until it's fairly dark in the room. And they keep saying, I can see well, because the body adapts to the darkness. It's the same thing. And then I turn up the light, and they go, wow, I didn't realize how dark it was in here. It's kind of the same concept with our health. Our health slips away over time, and little by little by little, and we don't even realize that we're losing our health. And then we chalk it up to old age. We say, well, what do you expect? I'm in my 60s, I'm in my 70s. And, people just accept that old age is like an illness. So that's one thing about the mindset that I try to teach people, is that the way they think about their health really affects the actions that they are willing to take. And it's very important also to focus your mind on positive things. A lot of times people get into negative interactions, and they have a lot of anger and different issues, which, by the way, in the Chinese healing system, they claim that all our emotions come from our organs. And that's something else I also address in the book. It's called the Inner Smile Meditation, and it teaches people how your eyes and your organs are connected. So, for example, you walk down the street and you see somebody get hit by a car. Typically, people will take their arms and just hold their chest because they felt something in the pit of their stomach or their heart hurt. So the same thing can happen with positive. And learning how to focus your mind, you can channel healing energy into your organs through your eyes and your thoughts and where you focus your mind. So yes, it's very important to focus your mind and think positive thoughts, because in reality, thoughts become things. And, it's also not about symptoms. People think if they don't have the symptom that they're well. Think about this, Tammy. If you have a heart attack, you speak to a person who had a heart attack, and you say, how did you feel 10 minutes before the heart attack? They're going to say, I felt great. I don't know what happened. Or if people have a stroke, it just happens. There was no sign, no symptom. Many people walk around with cancer and don't even know it because they're waiting for some symptom to occur. So that's a big illusion about health, is that you have to feel bad to be sick.
That's very interesting. I'm still reeling from your from the image of the accident, because you're absolutely right. When you see something like that, the first thing you do is you put your hands up, like cover your heart, and go, "Oh my God," like that. And I just did it as I visualized that. I actually put my right hand, it went over my heart, because it was like, it's almost like a protection thing that you do automatically. And I think you're really right about thoughts becoming things. And that's something that's really important in our health and our thoughts every day, is, like you said, if we see ourselves healthy, we can do that. And then just like you just said about, people do walk around and they can have cancer, or they can have heart disease or high blood pressure or other things and not even know it. I remember my former boyfriend, his father was in a car accident, and they took him to the hospital, and they found out that he had cancer throughout his entire body, and he died like within a couple days after that accident. And the accident was not any big accident. It was like a little fender bender. But it was almost as if when he found out he had cancer that he went, even though up until that little accident, like it was just a little fender bender, and he found out, and then he passed very rapidly after that. But I really do think that you're really accurate when you talk about thoughts becoming things. And I don't know that a lot of times people think about when they go to a healthcare provider like you, that these would be part of the conversation. Because when you go to a regular doctor, it's like, yeah, obviously you normally wait in the office for, way past the time of the appointment, sometimes an hour or more. You get in there and they're like in a hurry, and they'll, ask you different questions about, how do you feel, but they don't ever ask you any other types of questions about, other things. That they've got like 15 minutes. Can you tell me a little bit about...
They don't ask you about how you think about life and what your stress level is. They just look at a number from a blood test. And, it's not necessarily relating to the reality of everything that your life is about.
Right.
In my book, I talk about something I call mind-based realities. It's sort of like the stories that we tell ourselves. Like, where do we really learn everything we think? We usually learn it from our parents, our friends, TV, the media, and then people adopt that as their reality. And they don't ever sit down and say, well, what do I believe that's real? I remember when I was bringing my children up, I used to say something to them, and then I realized that's what my mother or father said, but I didn't believe that. And it was just automatic. And then I started to realize all these stories that we tell ourselves that we buy into that are real. But, the truth is, thoughts become things, as we said before. So when you tell yourself a story about, I'm not well, I'm sick, I'm depressed, I'm this, I'm that, whatever you tell yourself, that becomes the focus of your mind, and that becomes your reality, and that leads to multiple forms of illness. So it's very important to look at your story and say, hey, is this the story that I want to buy into? Is this who I want to be? Or do I want to repaint the canvas of my life with a new story of health, love, peace, and happiness?
Wow, that's beautiful. I like that. The idea that you can repaint the canvas of your life. I really like that. If I were to come into your office and make an appointment, can you describe what that process might look like? Like, what would we talk about? What would we do? What would an appointment be like with you?
Sure. Well, when I sit down to do my case history with people, I'm not only just listening to their words, but typically people can give you a lot of information about what's going on, and they really know their diagnosis most of the time anyway. But I also try to feel their energy. Like, are they upset? Are they stressed out? How negative they are. I observe their body language. Sometimes people sit there with their arms and legs crossed, and I realize that they're not very open. And so I try to maneuver my way into their consciousness to get them to open up by relating to them, by developing rapport with them. And that tends to help people let go of their blockages and think in a new way. Because truly, we need to think in a new way about our health. If you look at the health care of Americans, it's not getting any better. In fact, it's getting worse. So we need to think in a new way, because the old ways don't work.
You're absolutely right. What are some of the, I guess, I don't know if they'd be called modalities? You incorporate so many different things into your practice. Like, I'm listening. Most doctors, rarely have I ever heard a doctor say, I try to feel someone's energy and observation like that. And so I'm already sitting there going, wow, I'd like to go talk to you because I can feel that you really care about people and about me, because if you're going to be observing how I am, and you'll be able to address some of, the issues. Am I open? Am I closed? Am I afraid? What's eating at me? And you use acupuncture, qigong, massage, nutrition. Talk a little bit more about how all of those different things and how those are useful to being healthy.
Okay, well, I'll have to go back to my story a little bit because when I was starting my own rehabilitation and I was in karate class, I attained my black belt after like 5 years, and my teacher said, Posner, you're out of karate now. You're now doing Tai Chi. And I was like, what? I said, why? And he said, you're too tense. And, he was judging the fact that I had my ears up, my shoulders up to my ears. And of course, I was not conscious of it. And I'm feeling picked on by the teacher. And why are you doing this to me? And poor me. And how could you make me do Tai Chi now? I went from a very aggressive art to a very mellow, relaxing form of movements. And after about 6 months, my shoulders just dropped about 6 inches, and I went, oh, my God, he was so right. I am so stressed out and didn't realize. So Tai Chi was the first real experience that taught me deep relaxation. Tai Chi is a moving meditation, and we do these very relaxed movements, which we call a form. And Qigong is the movement of energy and breath control. So Tai Chi was also very involved with body structure, just like chiropractic is. And it taught me how to be more present in the moment and how to reduce the stress in my own life. But it also made me very sensitive to feeling energy, because Tai Chi, the internal aspect of Tai Chi is about energy flow, sort of like what they do in acupuncture, but you kind of do it to yourself with your mind. So there's another way. Your mind is extremely important, because when you focus your mind on your energy, the energy goes where you put your mind. Sort of like, they used to do biofeedback like this. People would have migraines because they had too much blood in their head. So they would have the people hooked up to a machine that would give them beeps or light intensities, and they would hook it up to their fingertips and make them focus on their fingertips. And when their mind focused on the fingertips, the blood follows, and the stress left their head because they may have had too much blood flow in their head. So these are some of the things that happen from learning to control your thoughts and your mind. Also, we integrate massage therapy and deep heat therapies. I use a robotic laser that I recently obtained that is incredible for healing on a very deep cellular level. I use something called pressure wave therapy. And all of this stuff I incorporate into my patient care depending on their needs. So I have lots of modalities to offer, and my daughter is an acupuncturist, so she works in the clinic, and we have massage therapists. So when people need these other therapies, I just integrate it into my treatments, and we get results that have exceeded the patient's expectations.
That's really interesting, because I was looking at your website and I was saying, wow, you can go there for everything. I was thinking in terms of massage therapy. I know that that's very useful. I've used that personally in acupuncture, and different things are all things that I was familiar with. Tell me, when you wrote the book, how did you come up with the title, Well Adjusted?
Well, we were racking our brains for names, and one of my friends said, why don't you just call it Well Adjusted? And I said, that's a great name. So I thought we adopted it because of him. And then I added on the journey of transformation for body, mind, and spirit, because all the techniques in the book are the things that I did to personally transform myself. And as you mentioned earlier, I am 67 years old now, and I got to tell you something. I feel like I'm healthier now than I was when I was a young man. I'm very mobile because of all the exercises I've done, the stretching, the relaxation. I'm more mobile than most of the 30 to 40-year-old people that come into my practice. And I feel like I'm getting better, and I look around at all my friends, and I see them becoming diabetics and heart patients and cancer. And it breaks my heart that they're not taking action to change. They keep doing the same things that keep them sick. And that's heartbreaking to me. It's very hard to communicate with people new ways of thinking about their health because they're really brainwashed by the current healthcare system that truly isn't serving them properly.
I hear that. I wanted to ask you, who do you think you can help the most of the different types of people out there? Who would be somebody who you could really help the most?
Well, we treat a lot of people with sciatica and headaches and plantar fasciitis, neck and back problems, and any kind of joint or tendon issue. But more importantly, in some ways, I do a lot of work with weight loss and nutrition, and of course, obesity is huge now in our country. 66% of our country is said to be obese. And so you definitely have to address weight. And when I look out at the other programs out there, such as Weight Watchers and Jenny Craig and these, fair diets that come in, most people, even if they lose weight, they gain it back. And the reason is because they're not addressing the underlying cause. It's just like medicine. If you have this symptom, take this drug. Well, now this is just a diet. If you have extra pounds, eat this way temporarily or buy our food. And it's not healthy, and it's not fixing the underlying causes. And what I mean by that is people have candida overgrowth, they have hormonal imbalances, thyroid and adrenal and hypothalamus imbalances, and their bodies are very toxic. So these are the underlying causes to real weight gain. And when people deal with that, it reduces their need for meds, for high blood pressure, for heart disease, for inflammation, which are really the underlying reasons that people are having these kind of diseases. So it's very important to fix people's gut health because that affects the immune system. So a lot of immune conditions will go there. In fact, that's how I fix my allergies. And that's how I fix it with multiple people, is I fix their gut health. Everything starts in your gut. You die when your gut is unhealthy. It poisons your whole body. And you can't absorb your nutrients and you can't eliminate toxins. So the digestive system is extremely important.
Wow, we could probably talk all day about all of the different things related to health. So I'll tell you what, I will invite you back and we'll do another interview in the future, and maybe we'll focus more on, maybe we'll just talk about weight loss, because when you were talking about that, that's one of my issues, and I realized that there has to be something in it besides just what I eat. And you mentioned, the hormone imbalance, thyroid, adrenals, and just the
candida
things. Yeah, I think we'll come back another time and talk just about that, because I think that is an issue that a lot of our listeners would be very interested in, because, like you said, obesity is such a huge issue that a lot of us are facing today. And we all want to live a healthier life. And, with all of the issues related to the health insurance and sick care, health care, I think people are confused. I know I'm an intelligent person, but even I'm confused over all this health care and insurance and issues related to, the government mandates and all of the different things. So I wanted to just ask you, if somebody wants to make an appointment with you or contact you, where's a good place for them to get more information?
Well, they can go to my website, which is huntingtonchiropractor.com, or they can call my office, which is 631-351-6111, and they could set up a free consultation to talk with me. And I would love to give them a free copy of my book if they came in. And I think that's the best approach.
Great. Wow. Get a free copy of Well-Adjusted, the international best-selling book, and that's Well-Adjusted, A Journey of Transformation for Body, Mind, and Spirit. Before I let you go, is there anything else that you'd like to say before we close out?
There is one more thing that you actually mentioned in the last things you were talking about was health insurance. And that's one of the saddest things I see, and one of the biggest blockages for a lot of people, because a lot of people think that if their health insurance doesn't cover something, then they can't have it, and they're unwilling to pay for it. And that becomes a big blockage because, nutrition and weight loss is not covered by health insurance. And sometimes people can't even get chiropractic care because their health insurance doesn't cover it, but yet they have a need for it. So I think people have to shift their consciousness a little bit and realize the health insurance companies are not responsible for your health. They're more like for sick care, and then there's health and wellness care, which may or may not be covered. So I think it's a big mistake not to get the help you need because you may have to pay some money. People are willing to pay for their car repairs. If you need a new transmission, I've had people say to me, well, if you need a new transmission for your car, what would you do? And they say, well, I would have to pay for that because I need my car. Well, don't you need your body? See, I think there's something missing in people's minds about the value of their health. They're not projecting into the future and looking at their parents and their grandparents and seeing what they're going through in their old age. And that is a creation. Health does not happen by accident. You must create it for yourself. And my book teaches people how to do that by giving them the foundational knowledge to live a long, healthy life and not to take old age as an illness.
I think you're right on target. Old age is not an illness. It's as you age. My dad's 91, and he still is checking out all the latest stuff in the stock market, and he goes for walks, he volunteers, he looks good, his skin looks good, he's healthy mentally, he's all there, he still drives. I mean,
that's wonderful.
He is somebody who is an example of health in old age, and I see it in a lot of people. And so you're absolutely right. And on that note, I just want to thank you so much for sharing with us today, Dr. Posner. So everyone, thank you so much for being here. This is Tammy Patzer. Go make it a beautiful day.
Thank you.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit OptimalHealthRadio.com.